in North London, and Dr. Chris Smith, a virologist at Cambridge University and host of the Naked Scientists podcast. Welcome to all our guests. Thanks very much indeed for joining us. I'm going to start with Hugh here in the studio. And this question is from Julia. She sent us this via email. Why is the UK not following the World Health Organization's strong advice to test every single suspected case of coronavirus?
Well, Clive, certainly the position was up until today, the impression given by the government was that they weren't going to carry on testing very widely, and that people who had symptoms, a persistent cough or a fever, should just go home and isolate for a week. They wouldn't get tested. If you listen to the press conference just a short while ago, Professor Chris Whitty, the Chief Medical Advisor for the government, was saying they are increasing testing, they are extending it, they're trying to go further. So a bit of a change of emphasis there, but sources tell me they just don't think they've got the resources to test everybody. They want to focus particularly on NHS workers and those who are most important or most vulnerable, certainly. So I think they've changed gear a bit on this, but they're not complying totally with what the WHO have suggested, which some other countries, but not all, are doing.
All right, OK, so it's a resource issue then when it comes to testing. Let me turn to Dr. Carmel Scher. This question is from David, who's in Nottingham. It says, is it possible to have coronavirus without having a fever?
I think it is. My understanding is that the main two symptoms are a fever, and they've set that fever at 37.8, and a cough, and the cough is persistent and it starts acutely and it's ongoing. But I guess there are cases where people will have a cough and they won't have a fever. And many people don't actually have a thermometer. So it's a very specific fever that they've set the criteria at. So I guess you can't have a fever sometimes.
All right, OK, so that makes detection then even more difficult. Let's go to Chris. How can you give, this is from Leanne, by the way, how can you give a confirmed number of cases when many of us showing symptoms are not qualifying for testing?
If I may, I'd like to build on the answer that Hugh gave about testing, because there is a lot of uncertainty around this. And the testing currently has been delivered by Public Health England in their laboratory network. And there were just 8 laboratories in England and then 4 others in the other countries. And they were delivering about 1,500 tests a day. This is going to scale because other NHS laboratories are joining the network, and this is going to bring us up to about 10,000 tests a day. But you can see that this is very easy to saturate quite quickly with the anticipated number of cases. So rather than just say everyone across the country would be blanket tested, the testing is being focused at the moment, at least, where it can change or affect the management of a patient. So how a person is handled in hospital. Very important, because if we get people coming in and they have the sorts of symptoms that we've just been hearing about, those symptoms could be any number of different infections. So it's very important that we don't put the wrong person with the wrong infection in the wrong part of a hospital, because that's how infections spread more. So by using the testing to guide how we manage people, it's really, really useful. Now, in terms of how we work out confirmed cases, those confirmed cases that are being reported, those are people with a positive test result. But of course, that's going to only be linked to how many tests we do. So it's automatically just a subset of the real number of cases in the country. We know that this is like an iceberg, and the tip of the iceberg is people being tested and testing positive. But below the waterline, there is almost certainly a very big wealth of numbers of cases which are either not having symptoms or having very mild symptoms, or being confused with the common cold. And that's why this has been quite easy to miss, and it's been hiding effectively in plain sight hitherto.
Sure. Again, it's about targeting the resources that are available. Back to Hugh, in the studio here. Why are we not closing schools and universities? This is from Norman, sent us this on email, and I think a lot of people are asking this question, given that it's going on pretty much everywhere else in the world.
Well, Clive, some universities are closing early. In fact, at least one I've heard of is saying to students, we can't even give you any exams in the summer, and we'll give you a degree mark based on your progress up until now. So universities in different ways are beginning to look at that or do it. With schools, the argument from the government, which is still being made, is that if you close down a school for a prolonged period, you end up losing more people from the workforce because parents have to go and look after children. The children could then go and spend time with grandparents who are vulnerable because of their age. and they will be carrying the virus even though they're not particularly vulnerable themselves in terms of the impact, they could spread it more widely. That still seems to be the government line, though clearly there are school closures in the Republic of Ireland and in other European countries, so this may well be reviewed. We've seen a big change of policy just in the last few days, so it's possible this might change again. But as of now, the school closure issue is not on the table as one of the measures.
Sure. I mean, the Prime Minister making it clear that the situation is fluid and that could absolutely change. Dr. Sher, if I could turn to you again. This is a question from Anne, and she says, what is the advice to those who believe they have contracted coronavirus?
Well, I think the advice seems to be changing every day. But it was isolate for 7 days and look after yourself with the symptoms that you have got. And I think what you don't know necessarily is whether it is actually coronavirus or it is actually just another kind of infection, because there are plenty other infections that will present in a similar way. So treat yourself as you would treat yourself with any other infection. Take care of your nutrition, treat any fever, and particularly with this particular thing, it's about self-isolating and keeping away from other people. And I think the advice has just changed about self-isolation and families.
Indeed, it has. You may be well within a household, but if there's one member who is showing symptoms of fever and so on, persistent cough, then the whole household has to self-isolate. Does that make sense to you?
Well, I guess I would follow the advice that we've been given.
Sure.
We've got some very good epidemiologists that are giving us this advice, so I'm not an expert in that area, so right. I'm following that advice.
OK. Chris, let me turn to you again. This is from Sarah. If you personally have underlying health conditions, you've to self-isolate. Does that mean the whole household should self-isolate? We've actually touched on this just now. Is that something that makes sense to you too?
Well, in terms of this self-isolation, and just to build on the answer that you've just heard to the previous question, the rationale behind saying 14 days is that the average incubation for this new coronavirus is about 5 days. So if you have a group of people who are living together, one person joins the household and that person then infects everyone else in the household, if you allow 14 or 15 days, that should be more than enough time for the person who's got it to then infect everybody else if they're going to. It's not a given. And then those people to become symptomatic and then clear the infection. So it would go through in a sort of a 1-2 punch like that. So that's the rationale for extending it to 2 weeks, to try to allow time for that to happen. Now, in terms of what to do if you're living with someone who's in a vulnerable state, then obviously they are at higher risk. And one has to use common sense here. The best advice to people who are living with people who might be at higher risk, people who have underlying health disorders, they are advanced in years, which means they may also have underlying health disorders. In those circumstances, you just have to use your common sense. If it's possible to avoid infecting those people, you'll just have to do that by perhaps giving them their own bathroom and bedroom to go into while you're occupying the rest of the house, and you arrange to try and clean up carefully after the person who's having symptoms has stopped having those symptoms, etc.
All right. Chris, thank you for that. I'm going to ask another question to you, Hugh, here. This is from Esther. Should we still attend local hospital appointments?
Well, the interesting thing here is, will there be any outpatient appointments? Because the strong guidance has been that at some stage in England, all elective surgery, that is non-urgent surgery and operations and procedures, and non-urgent outpatient appointments will just be cancelled. It's already happened in Wales. Of course, if you're having an appointment for cancer treatment, that I think will go ahead. But there's been a lot of speculation about whether the NHS can cope with the overall workload. Certainly if it's what we might call a routine appointment, obviously very important to the patient, at some stage it just won't happen. But I think people should take advice from their local NHS trust as to what is happening. In Wales, it's already been completely set aside, that sort of routine appointment.
Following on from that, Carmel, this is from Catherine. She says, what is considered a serious underlying condition? I have MS, but I am not sure whether this is considered less serious at this stage.
There are many underlying conditions, and I think there's quite a lot of questions I've been asked already by patients that I've seen is what is serious and what is not. I mean, I think what I can say on that is there are many underlying conditions such as cardiovascular disease. Those are things like heart attacks, blood pressure that are very common. There's diabetes, there's respiratory conditions. Some are very well managed and some aren't. And perhaps that is something that people, I guess, need to think about, is about making sure that whichever underlying condition that they have, they manage it well. I guess that's what we try to do as GPs day to day. But I think a lot of people are very worried because it covers a broad range of various diseases.
But surely one would have to check with one's GP, and that in itself is going to put an extra burden on the NHS in the middle of this pandemic.
Well, to date, GPs are still taking a lot of telephone consultations. So we're doing quite a lot of work on the phone, maybe reducing our face-to-face to try and reduce footfall, both to protect patients coming out and also the staff that are working within GP surgeries. So a lot of those questions are being answered on the phone.
Right.
And we've given quite a lot of advice to people about how they manage their own particular condition. And I'm sure that advice will be going on as far as I can tell for the moment.
Sure. OK, I'm going to turn to you now, Chris. This is from Jibril in Luton. What advice is being given to people with asthma?
And in fact, Chris Whitty, in his press conference this afternoon with Boris Johnson, made a very useful remark which concerns people with underlying disorders like asthma. And they said that the people they're most worried about are people who would fall into the criterion for having the flu vaccine. So that's a useful way to remember the kinds of people and the kinds of conditions that mean you are regarded as at slightly higher risk in this circumstance. Now, where asthma is concerned, it is on that list because people with asthma could have poorly controlled asthma, because asthma in some cases is very, very mild. And for instance, a person may only experience symptoms when they go out on a very cold morning or they walk too fast. And that might make them a little bit wheezy. But other than that, they're fine. Some people, on the other hand, have very severe asthma. This is referred to as brittle asthma. They may be taking lots of medication to control that. And they may be taking medication that includes immune suppressing medication, whether that's inhaled or under certain circumstances, pills they actually have to swallow to damp down the immune system. Now, in those circumstances, they are regarded as at higher risk, and those individuals should take steps to try to reduce their likelihood to the greatest extent they possibly can of catching this, because anything that causes your chest to be weaker or less resilient than another person of the same age as you is at higher risk, and you could have a worse outcome from this infection. So under those circumstances, if you do know that it's making you worse, or you catch this, you suddenly get symptoms and they appear to be exacerbating, then you would be urged to phone 111 and ask for further advice, because it may be that you need a bit more help.
Sure. OK. Back to you, Hugh, here. In light of the new advice coming out today, this is from Paula in Norfolk, can I still take a weekend break in the UK?
Well, to take the Prime Minister's words at face value, it's basically avoiding non-essential public contact.
Yeah.
So that would cover pubs and clubs and possibly a weekend break. I guess if you've already booked it, nobody's going to say you're not allowed to go. It obviously just means people just have to exercise common sense. And if they're going on their weekend break, maybe not go into a crowded pub or a bar or whatever. But the issue of enforcement is another thing. These are not measures that can be enforced. This is guidance, although there will be legislation at some stage on government powers, I think, sometimes to force people to go into quarantine and that sort of thing. Yeah,
I mean, the Prime Minister today made it clear that there are enforcement measures that they can take, or there are mechanisms by which they can enforce certain things. But he still hasn't gone that far. And I'm wondering if what the psychology is as a result.
Well, maybe the psychology is nudge here, that if everybody knows that the guidance from the government is don't go to the pub or to a club or out into a restaurant or something, then you don't want to be seen in there, because people will say, well, why are you going out? Maybe that's the behavioural psychology. And the Prime Minister did talk about everybody as an individual having a responsibility here, and maybe most people will take that responsibility seriously and not go out. Obviously, there may be some who do, but there doesn't seem to be any enforcement action there. But maybe it's the power of persuasion which will have an impact. Certainly, that's what ministers will be hoping.
That's the hope. All right. OK. Let's turn back to Carmel. This is from Virginia. She sent us this via email, this question. Is it possible to test COVID-19 retrospectively? That is, if someone thinks they have had the illness and recovered from it, is it possible to test for the presence of antibodies to the virus?
Well, that's probably being developed as we kind of speak. I mean, once you've had a virus, you do develop some antibodies towards it. And often that's what they look for when they're especially testing for sort of common diseases like if you have an infectious disease, let's say whooping cough or, a disease that was notifiable. Sometimes we'll test to see whether somebody's been exposed to it. So I suppose they will be developing a way of testing for it. But I understand that's not quite what they're doing now, although it would be a useful thing to know because it would mean that, people that are vital can get back to work if they've had it.
And that's the rationale behind the concept of herd immunity, right?
Yeah, sort of. Yeah, I think that's another sort of big question.
All right.
It's another discussion.
Okay.
But in terms of answering the email question, yes, I'm sure there is something that is being developed, but I don't suppose that's the focus right now.
Sure.
And I guess the point of testing for something like that would be to keep things going and keep the important people that need to be out there working.
Sure, absolutely. All right, let me turn to you, Chris. This is from Sonal. Are there any precautions taken for dentists, nurses and dental colleagues who are in close proximity to a large number of the population on a daily basis? He says he's a dentist working in a large, busy NHS practice.
Right. The answer is yes. And guidance was issued and then revised initially around all kinds of respiratory infections, revised just specifically for this one last week. The guidance is that people with an unknown respiratory illness, people who are exposed to those individuals, should wear a surgical mask in the first instance. When we then know the diagnosis, is this person infected with this new coronavirus, then we would step up and we would use more stringent protection, which includes what we call an FFP3 mask, which forms a tighter seal around the nose and mouth. It filters down to a much smaller number of particles than the surgical masks do, and also people wear eye protection as well, and other things like an apron and gloves and so on. So yes, there are guidelines, but also a lot of these non-essential appointments, such as routine dentistry and hygienist treatment, for instance, a lot of that's going to be cancelled, I would say, probably because it's regarded as non-essential. It wouldn't be helpful to have those people at work being exposed unnecessarily at this stage. So I suspect that will become less important than protecting healthcare workers in the hospital setting and in general practice, where the guidelines I've just outlined are the ones that we're all using.
All right. OK, thank you for that, Chris. I think we've got time for one final question for you, Hugh. This is from Natalie. Please, can you clarify who exactly are in the at-risk groups? I'm 40 weeks pregnant and asthmatic. Would any asthma mean I would fall into this group, not be able to take my newborn baby out, even if we do not have the virus?
Well, there's a complicated bit of this today because these measures were only announced in the last hour or so we do await further detail, but there seem to be two strands to it. One, if you're over 70, if you're pregnant and if you have a health condition, then you should take particular care with observing these new suggestions, guidelines on social contact. In other words, be very careful about going out into public areas. But then they say for people with the most serious health conditions, I understand this is about 1.4 million people. There's no clear guidance on exactly who that covers, but certainly it would be cancer and leukemia, as far as we know, and others. The advice there is basically stay at home for 12 weeks. Avoid any social contact at all. That's a big thing to be telling those people, and we do await further guidance on who exactly that would cover.
Sure. OK. Hugh, many thanks for that. Hugh Pym, our health editor there. And to you, Dr. Carmel Sher and Dr. Chris Smith. Thanks very much indeed for your perspective and expertise on that. Thank you. So that's it for your questions today. As this pandemic continues, I'm sure we will be having more opportunities for you to send us your queries and your questions concerning this enormous topic. Well, Katty Kay and Christian Fraser will be here at 7 o'clock with Beyond 100 Days. I'm going to be back at 8. That's all coming up after a look at the weather. Here's Nick Miller.
Hello, the rain we've seen today move into Scotland, into Northern Ireland, will tonight head into parts of England and Wales. Not everywhere though, and it's particularly towards western areas of England, especially northwest England and Wales, where the rain will be heaviest and most persistent into the hills. Now, we clear the rain from Scotland and Northern Ireland to leave a few blustery showers here with clear spells. And there'll be clear spells still into parts of southeast England, so maybe a touch of frost here.